Well, actually, I started attending the yoga sessions with Jackie about a year ago when I had the opportunity on my lunch hour while I was working here at the Cancer Center. And I found after being there for half an hour and experiencing the session with Jackie that I could come back to work and I was more relaxed. I cleared my mind. I was able to focus better and I felt provide good care to the patients.
I went to your in-service that you gave and I was quite stunned, in a nice way. I thought that what you presented was beautifully done and it would be extremely useful to not only patients who are going through, the burden of cancer, but for caregivers, their caregivers, and almost certainly also be useful for the staff during these stressful times. So I have to congratulate you on doing really an extremely good job.
As a social worker, I'm always dealing with persons' emotional responses to the physical things that are going on within them during their cancer treatments. And I don't think it's just physical, but it's emotional, physical, intellectual, spiritual, all put together. And as we do the kinds of things we do in the Cancer Center, yoga certainly has a role to play in that for those persons who want to try it, who are patients.
Not everyone wants to participate in a group. They're very cognizant of their privacy. Certainly that group of patients would benefit.
Anything that makes the burden of care better, easier, the burden of cancer, their treatments, the psychological burden, the physical burden, emotional burden, anything that works towards complementing the sort of nasty care that we give, the medications and all the things, really is helpful. And I'm very encouraged that you as a patient, also as an educator, are trying to do this project, and that you'll come up with some really good ideas, some good plans, some really useful things that will help pretty much everyone.
Jackie is an inspiration to us all. She is a breast cancer survivor who has taken this journey through a really difficult time and turned it into something positive that we can use as an inspiration. She has taught us how to use these negative things and turn them into positive things for wellness, and that is really the bottom line. The Dragon Boat Committee has shown a lot of leadership in stimulating funding in the region for not only research, treatment, diagnosis, but also for some of the other things outside of the medical profession that are helpful to patients, including things like Jackie's DVD. This really helps women empower themselves to go through treatment and to help themselves to get better, which I think is very important. There's only so far that medical technology can go in terms of treatment, and I believe it's very important for patients to take charge of their own health and to also use some of the other things that are available to them, such as yoga, nutrition, meditation, exercise. These are all things that are not really medical, but definitely affect outcomes. So it's positive. And Jackie is inspirational in bringing this to women who are cancer victims and also cancer survivors.